Across the divisions in general surgery, we have national and international experts who guide our development as house staff. The breadth of our training extends from the maximally invasive ED thoracotomy to the state-of-the-art minimally invasive approaches utilizing both advanced laparoscopic and robotic techniques. Our flagship hospital serves as a tertiary and quaternary care center for many hospitals in Central Virginia. Additionally, rotations at our VA and community hospital prepare us well for the modern practice of surgery. For residents who are interested in research, we have various funded labs and established research opportunities in basic science, clinical outcomes, quality improvement, and global health. VCU has a proven track record of matching residents in high quality and highly competitive fellowship programs. For people who are more interested in going directly into practice, our graduating chiefs have the confidence and skills to make that goal a reality. We are dedicated to continually improving and adapting to help our house staff achieve their academic and personal goals. Above all of these, though, what stands out the most is the camaraderie among the residents and the collegiality among the house staff and the attendings.
We have a very structured surgical education program at VCU. It is residence-driven and oriented. We have protected education time on Thursdays for 3 hours. We use the core surgery curriculum for our basic science lectures and TrueLearn for weekly board question quizzes. One of the best ways we believe to learn something is to teach it, so we have our mid-level and senior residents present the weekly lectures with the faculty acting as a moderator. We also have chief reviews every week using the CSAB questions with operative technique and decision-making discussions. The conference is directed for our chiefs to prepare for the written board exam, but all residents are welcome to attend. We also have mock oral board exams done twice yearly for the senior residents. We also have added this year upside practice sessions for 10 weeks prior to the exam. We also have started a robust, structured robotic training program for both the junior and the senior residents, with 2-to-1 faculty to residents teaching. Our aim is to have all our PGY residents certified for bedside assist and all our seniors to graduate robotically certified. We also have an organized sim sessions training for all PGY levels to ensure coverage of the American College of Surgeons required resident skills. The sim sessions include training on cadavers for abdominal wall reconstruction, vascular and bowel anastomosis, and the acid trauma course. We have now a system through which the sim curriculum is able to graduate residents certified for the FLS and the FES by the end of their second year.
Having worked in multiple different hospitals during my training, I can confidently say that the critical care volume and acuity at VCU is unmatched. We care for critically ill trauma, burn, and surgical patients of all types. And as one of the major referral centers in Central Virginia, we see an incredible breadth of pathology. You will also have ample exposure to bedside procedures, including various lines, chest tubes, bronchoscopies, and bedside tracheostomies, as well as gain expertise in critical care ultrasound techniques during your training.
We see general surgery residents in almost every year of their training, and you'll learn something new every year that you're with us. We see patients with complex colorectal disease, including inflammatory bowel disease, colon and rectal cancer, anal cancer, pelvic floor disorders, and anal rectal disease. While on our service, you will work with us in the inpatient surgery setting, where we perform a wide range of open, laparoscopic, and robotic cases. In addition, you will join us in the outpatient surgery center, where we do most of our anal rectal surgeries. You will also rotate with us in endoscopy, where you will learn to perform colonoscopies. General surgery training is very complementary with colon and rectal surgery. You'll learn to do laparoscopic colectomies, be comfortable in the pelvis, and operate on the anus and rectum. We look forward to having you on our service.
I was interested in lab to begin with, and I looked into it. Starting my intern year, I can say that Dr. Anand is very supportive, and he'll meet with you regularly to make sure you get what you want. Currently in Dr. Mangino's lab, I never had to worry about funding since he has a very well-established lab with a lot of money. All I needed to do was to express interest. I'm currently working on low-volume resuscitation therapy on septic shock models. I work mainly on rats and pigs. We do legitimate surgeries on these animals. I also do clinical research with Dr. Lanning. He's very productive, publishing lots of papers. He's also very fun to work with, which makes it that much better. We're currently developing a URAS protocol for pediatric patients. All that to say, I've had a great experience with research so far. There are great opportunities here if you're interested. Previous residents have done really well wherever they went, and I'm hoping to continue that tradition.
Surgery residents at VCU have the option to take 1 to 3 years for professional development and research following their PGY2 year. These years are funded, and options include basic science, translational research, outcomes research, quality improvement fellowships, global surgery, and now a 3D printing fellowship. Residents have also obtained their MPH or other advanced degrees during these research years. Residents may choose from many opportunities offered here locally in the Richmond area, or they may opt to participate in research at other institutions. Residents have been very productive during their time, with multiple residents receiving grants, podium presentations at national conferences, and first author publications. Additionally, research residents are encouraged and permitted to moonlight at both the VA and the VCU medical centers for additional income on top of their research stipend.
Our GI bariatric service is a very special rotation among the residents at VCU. It's a pretty robust service. Roughly, we see about 400 endoscopies a year. They see 200 minimally invasive general surgery cases, as well as about 350 bariatric surgery cases, including sleeves and bypasses. We rotate through the service as interns and second-year residents, giving us early exposure to some of the more complex, minimally invasive cases. We're also fortunate to have teaching faculty that are well respected in the field, and what's even more important is their emphasis on teaching. We have weekly conferences where we review cases and complications within the service itself, and it gives you a great opportunity to solidify what you've learned in the OR and sort of help apply that to your own individual practice. I really feel like going through those rotations has made me a better resident, and I hope you have this opportunity as well.
Every trainee wants to know about the opportunities to participate in global surgery. I recently completed my 2-year Global Surgery Research Fellowship at VCU. During my fellowship, I had the opportunity to live and work in Rwanda, conducting research, teaching, and streamlining protocols for those working on the ambulance. I also had the chance to work with medical students and surgery residents. I operated with Rwanda's only pediatric surgeon. I later traveled to Ecuador to work with one of our trauma surgeons, Dr. Rodas. I worked with his foundation, Cinturandes, on their mobile surgical unit. I was able to perform laparoscopic surgery and assess patients in the heart of the Amazon rainforest. The following year, I completed my master's in public health at VCU. I was able to present my research at conferences around the world and publish my findings. My experience was incredible, and you can have similar opportunities here at VCU Surgery.
Many of you have already spent some of your training time at a veterans hospital, but as the saying goes, if you've seen one VA, you've seen one VA. So I'd like to tell you a little bit about our VA here in Richmond. Housed in a 1.2 million square foot, 400 bed facility, we are one of the largest and most complex VAs in the country. In addition to a new cancer center, simulation center, and surgical endoscopy unit, we offer complex surgical care spanning 12 surgical specialties. Our cardiac surgeons perform LVADs and heart transplants on site. Our urologists and general surgeons have been offering robotic surgical techniques for almost 20 years now. And we've recently opened programs in surgical gynecology and bariatric surgery to serve our rapidly growing patient base. Though attending surgeons are physically present to supervise all operative procedures and clinic consultations, we strive to give you as much autonomy as possible in order to hone your clinical decision-making, teaching, and leadership skills.
The surgical oncology experience at VCU is pretty comprehensive. The operative experience covers all the major systems throughout the 5 years. First years typically operate on the soft tissue masses, skin neoplasms, and breast cases. When you rotate again as a third year, you're in charge of the consult service and assist in all of the neck cases. That includes thyroid, parathyroid, and the soft tissue masses of the neck. During your chief year, you run the primary service, and the experience shifts largely to the abdominal solid tumors. So that includes things like primary gastric tumors, biliary tumors, and pancreatic masses. We're also one of the few centers in the country that does HIPEC with cytoreduction, which you'll see and participate in at every level. Finally, there's also the great experience on the Winchester rotation, where the third and fourth years spend 2 to 3 months with the surgical oncology group there. It's great because you're the only resident on the service and get to pick and choose which cases you want to see. Our residents graduate, no matter what specialty they end up going into, with a very broad exposure to surgical oncology.
Our burn rotation is wonderful. You get to be in the operating room every day and learn how to do pretty complex skin grafts as well as complex wound care, which is always good to have in your back pocket for even other rotations. The attendings really care about our education and are great about including us in all cases, as well as the NPs and nursing are also really critical to our learning experience here. We have a wonderful new burn center, which is pretty state-of-the-art and even has its own operating rooms. So overall, the rotation is wonderful.
The vascular surgery experience in our program is at both the VA and VCU, and we have 8 attendings between the 2 locations. Vascular is a fast-paced and challenging service at VCU for interns who perform basic cases and amputations as well as help manage the floor and ICU. Third-year residents experience truly the full breadth of vascular surgery during an operatively heavy rotation at the VA where fellows rarely go. They fully run the service along with an intern and nurse practitioners, and it's become a favorite rotation for a lot of people. For interested residents, there's also the option of rotating at the VCU service again as a senior resident. Primarily, people who do that are those considering applying for a vascular surgery fellowship. Our program is especially strong in vascular trauma, complex endovascular reconstruction, and complex aortic surgery. We do these cases primarily in the 3 state-of-the-art hybrid operating rooms at VCU that have robotic C-arms with an on-table CT as well as CT fusion technology. A brand new hybrid room is also being built at the VA. Both locations have truly world-class OR and support staff. We look forward to working with you in the future.
We have a phenomenal program here to grow as a confident surgeon and as a strong individual. Our faculty is interested in you as a person and are approachable with any concerns. They understand residency is very challenging, physically, mentally, and emotionally. We're fortunate to have a fun and supportive team of residents, and we regularly go out for dinner to catch up on life. And this includes everyone from chiefs to interns, spouses, kids, and friends. We celebrate birthdays, weddings, and anniversaries as an entire department. If you have a loss in your family or are welcoming a new baby, we coordinate that time off you need to recover and to be with your loved ones. There's childcare available with hours that agree with our busy schedule, and many of our residents and attendings take their kids there. We make sure that you get the time off you need to make sure you get to your health appointments to keep you at your healthiest. If you need mental health support, we find the resources you need. No stigmas attached. We have also created a committee for the development, engagement, and wellness of our entire surgical department to focus on promoting well-being. At VCU, you will work in a cooperative and inclusive environment to become a strong and resilient surgeon.
The VCU Trauma Center is the largest Level 1 trauma center in the region, with over 4,000 trauma activations each year. Patients present with a variety of injuries, including falls, blunt trauma such as car accidents, burns, and with penetrating injuries such as gunshot or stab wounds. Surgery residents serve as the primary evaluators of these patients in the trauma bay, with assistance from the emergency department and anesthesia teams. This gives you the opportunity to develop your rapid evaluation skills, as well as gain experience in procedures such as central and arterial lines, chest tubes, and occasionally thoracotomies. Patients in need of surgical management can be taken directly to the operating room for further treatment, or if more stable, can be taken to our dedicated CT scanner for further evaluation. Our trauma bay is a state-of-the-art facility with 6 resuscitation bays as well as 4 additional rooms that are able to be scaled up to meet the needs of our patients in the Richmond community. Our trauma rotation serves as a strong learning opportunity for both junior and senior surgery residents.
The cardiac surgery service at VCU is a fast-paced, dynamic service that cares for a very diverse patient population. We specialize in complex heart surgery, including mechanical support devices, ECMO, valvular disease, coronary artery disease, total artificial hearts, and heart transplantation. While on our service, you'll be an integral member on the floor caring for patients in the intensive care unit and our outpatient clinic, as well as in the operating room. As a resident, you'll be seeing consults, caring for our daily patients, performing bedside procedures, working in the operating room to learn more about the conduct of cardiac surgery, and helping procure hearts for transplantation. It is our goal to provide you with the opportunity to learn as much as you can about a clinically busy service with exciting surgical operations.
In your 3rd year and your 4th year, You are on the more general surgical side of it, where you get to work with a private practice surgical group, the Winchester Surgical Clinic, as well as the surgical oncologists. This is a very unique experience in the sense that you see the private practice surgery world. And with the surgical oncology group, you get to work very closely with 3 surgical oncologists. During this time, you're able to manage the floors, you're operating pretty heavily, and you really get integrated as part of the team. Outside of that, you're able to live in an apartment that the department provides for you, and there's plenty to do in Winchester, from the Apple Blossom Festival to the rolling mountains nearby, as well as DC about 45 minutes away.
We rotate on the transplant surgery service through the Hume Lee Transplant Center in our 1st and 3rd years. We also cover transplant call during our weekend and night calls. The service is a highly operative experience for residents with currently 8 transplant attendings. We get exposure to a wide variety of procedures, including liver, kidney, pancreas transplantations, in addition to dialysis access, liver resections, and robotics. As residents, we also get the opportunity to go on procurements, which allows for some of the best anatomical exposure and learning. The rotation has been pivotal in motivating residents for the last 3 consecutive years to pursue a career in transplantation.
Our pediatric surgery experience at VCU is unparalleled to most surgical residency programs with a quaternary level children's hospital for several reasons. First, the pediatric surgery attendings at VCU are the only board-certified pediatric general surgeons in Central Virginia, and despite their operative volume at VCU and the community hospitals, they invest a significant portion of their time in our education and professional development. If you express interest in pursuing a pediatric surgery fellowship, our attendings go out of their way to guide and mentor you in order to be a successful applicant. In fact, our institution has had a strong history of placing residents into pediatric surgery fellowships. Second, because we do not have a pediatric surgery fellowship, the surgical cases that residents first assist on range from appendectomies to TE fistula repairs, PSARPs, and CDH repairs among children and adolescents who reside in Central Virginia and even abroad through our partnership with the World Pediatric Project. Third, speaking from personal experience, our attendings provide us with level-appropriate autonomy in decision-making and in the operating room. Finally, if I haven't convinced you yet, a brand new standalone pediatric hospital, Children's Hospital of Richmond at VCU, will be completed by spring 2023. This state-of-the-art facility will further enhance our experience in providing care to the children and adolescents of Central Virginia and abroad.
As someone who's not originally from Virginia, I can tell you that Richmond is a great place to live. There are so many different options on living locations. It could be in apartment buildings, converted hotels, old renovated tobacco factories, or historic Victorian homes. You can live in the downtown area and have the advantage of being able to walk to work, which is a fantastic advantage when you've had long nights at the hospital. The other options is that you can live in the surrounding communities of Church Hill, the Fan, the Museum District, or Shockoe Bottom. Lots of different options. And when you're in the city, Richmond has really become quite the foodie town. You'll find all over the city different farm-to-table options where the menus change as the ingredients change, and it always makes an excellent culinary experience. And Richmond has very close proximity to the Chesapeake, so we have some great seafood in our city. You're looking for any kind of cultural activities, we have theaters, we have museums, and it's just an excellent opportunity to see traveling Broadway shows, the Richmond Symphony, the Richmond Ballet, or any kind of musical concert, or even traveling up towards DC and having easy access to big outdoor concert events. Looking for some kind of outdoor activities, the surrounding communities, or even in the downtown area, we have the River City. So you have the James River. You could be kayaking, you could be stand-up paddleboarding, you could be white river rafting. Or you could do what I do, which is run along the trails, the islands, Belle Isle, Browns Island, up and down bridges, just an amazing place to live.
Thanks for watching. And there you have it, VCU Surgery, a phenomenal place to train, grow, and live.